Good morning, students. Today, we will be diving into the fascinating field of gastrointestinal bleeding scintigraphy. Gastrointestinal bleeding is a complex and potentially life-threatening condition that requires accurate diagnosis and prompt management. Scintigraphy, also known as nuclear medicine imaging, plays a pivotal role in the evaluation and management of gastrointestinal bleeding. Throughout this script, we will explore various aspects of scintigraphy and gastrointestinal bleeding, including the pharmacokinetics and biodistribution of radiotracers, specific scintigraphy findings in different types of gastric ulcers, the identification of small bowel bleeding sources, and the utility of SPECT/CT and gastrointestinal bleeding scintigraphy. Furthermore, we will discuss the role of hybrid imaging in determining treatment modalities, interpreting scintigraphy in the context of active hemorrhage, evaluating post-surgical complications, assessing mesenteric ischemia, and its applications in pediatric patients. Additionally, we will delve into quantitative analysis and scoring systems in scintigraphy interpretation, the clinical impact of scintigraphy-guided interventions, and finally, explore future advancements and emerging techniques in gastrointestinal bleeding scintigraphy. So let's begin our journey into this captivating field. Pharmacokinetics and biodistribution are crucial to understanding the behavior of radiotracers used in scintigraphy. Radiotracers are administered to patients via various routes, such as intravenous injection, oral ingestion, or rectal administration. Once introduced into the body, radiotracers undergo specific metabolic processes and are distributed throughout different organs and tissues. These processes involve absorption, distribution, metabolism, and excretion, ADME. Knowledge of the pharmacokinetics and biodistribution helps radiologists interpret scintigraphy findings accurately, allowing for the identification of bleeding sources within the gastrointestinal system. Gastric ulcers can be classified based on various criteria, including location, etiology, and severity. Scintigraphy aids in the differentiation and characterization of gastric ulcers, enabling clinicians to determine the extent of ulceration and identify any associated complications such as active bleeding, perforation, or infection. Through the use of specific radiotracers, scintigraphy provides valuable information regarding the location and activity of the ulceration, facilitating appropriate management decisions. Small bowel bleeding can present a diagnostic challenge due to its complex anatomy and the difficulty in visualizing these regions using conventional imaging modalities. Scintigraphy, however, offers a non-invasive and sensitive method for identifying the source of small bowel bleeding. By utilizing radiotracers with high affinity for gastrointestinal bleeding, scintigraphy enables the localization of bleeding sites, guiding subsequent interventions and facilitating targeted therapy. Combining single photon emission computed tomography, SPECT, with computed tomography, CT, enhances the diagnostic accuracy of gastrointestinal bleeding scintigraphy. SPECT/CT fusion images provide anatomical localization of radiotracer uptake, facilitating the identification and characterization of bleeding sources in a precise manner. This integrated imaging modality offers detailed anatomical information, aiding in surgical planning and improving patient outcomes. Hybrid imaging techniques, such as positron emission tomography/computed tomography, PET/CT, and single photon emission computed tomography/computed tomography, SPECT/CT, enable the fusion of functional and anatomical imaging data. In the context of gastrointestinal bleeding, hybrid imaging allows for comprehensive assessment, assisting in the determination of appropriate treatment modalities. By providing precise anatomical localization and functional information, clinicians can select the most suitable intervention for each patient's specific condition. Active hemorrhage within the gastrointestinal system requires urgent identification and management. Scintigraphy serves as a valuable tool in localizing and assessing the severity of bleeding, allowing for prompt intervention. By recognizing specific scintigraphy findings indicative of active hemorrhage, radiologists can guide clinicians toward the most appropriate course of action, potentially preventing critical outcomes. Following gastrointestinal surgery, patients may experience postoperative complications such as anastomotic leaks, abscesses, or fistulas. Scintigraphy, with its ability to detect altered patterns of radiotracer uptake, helps in the evaluation and characterization of such complications. By providing functional information, scintigraphy assists clinicians in identifying post-surgical complications early on, guiding appropriate management strategies. Mesenteric ischemia, a severe condition resulting from inadequate blood supply to the intestines, requires urgent diagnosis and intervention. Scintigraphy offers a non-invasive means to assess mesenteric perfusion and identify areas of ischemia. By utilizing specific radiotracers capable of detecting perfusion abnormalities, scintigraphy aids in the early detection and localization of mesenteric ischemia, enabling timely and appropriate management. gastrointestinal bleeding can occur in pediatric patients, posing unique challenges for diagnosis and management. Scintigraphy, with its lack of ionizing radiation and non-invasive nature, is particularly useful in this population. By adapting scintigraphy protocols to suit pediatric patients, radiologists can accurately identify the bleeding sources and facilitate optimal treatment for improved pediatric outcomes. The interpretation of scintigraphy findings can benefit from quantitative analysis and scoring systems. By objectively measuring radiotracer uptake and implementing standardized scoring criteria, radiologists can enhance the reproducibility and diagnostic accuracy of scintigraphy interpretation. Quantitative analysis and scoring systems provide a more comprehensive evaluation, aiding clinicians in decision-making processes for optimal patient management. Scintigraphy-guided interventions play a vital role in the management of gastrointestinal bleeding cases. By precisely localizing the bleeding sources, scintigraphy enables clinicians to perform targeted interventions, such as angiographic embolization or endoscopic therapies, leading to improved patient outcomes. Scintigraphy-guided interventions contribute significantly to the multidisciplinary approach in managing gastrointestinal bleeding. In this rapidly evolving field, ongoing research and technological advancements are paving the way for exciting future prospects. Emerging techniques, such as molecular imaging and theranostics, hold immense promise in enhancing the diagnostic capabilities of scintigraphy in gastrointestinal bleeding. These advancements are expected to revolutionize the field, further improving patient care and outcomes. To summarize, gastrointestinal bleeding scintigraphy is a valuable tool for diagnosis and management. We discussed its various uses, interpretation and bleeding situations, post-surgical complications, and pediatric applications. Continuous learning is essential for delivering the best patient care in this field.